Welcome back to the Deep Dive. Today we're really plunging into, the sheer complexity of keeping a public healthcare system going,
Yeah.
especially during the toughest time of year, winter in Ireland. We have this fascinating document here. It's the Servisource Winter Plan for 2025-26, and it's quite something. It details how this key partner actually celebrating 25 years supporting the HSE plans to deliver support. It's more than just a list of services. It feels like a strategy for resilience.
It really does. And what jumps out, I think, is the sheer scope. Their whole philosophy seems to be a role to play at every stage of a patient's life.
Right.
They're not just, filling isolated gaps. It's about continuity from birth right through to end of life. And their value proposition nails it. The right people with the right skills and knowledge in the right place.
That complete coverage idea, that's what we really want to unpack for you today. Our mission, if you like, is to map out this whole integrated system. We'll trace that patient journey and see how Servisource helps ease the pressure on the HSE, especially during those peak winter months.
So let's start, right at the very beginning, okay, birth and early years. The plan talks about foundational support here. Specialist nurses, midwives, crucial for maternity care, obviously. Supporting moms and newborns when things are pretty intense.
Absolutely. But it gets logistically quite complex when a vulnerable baby needs to leave the hospital. That's when my home care team comes in. They offer incredibly 247 critical care support in the home.
In the home, wow.
Yeah, it's a very high standard, ensuring that transition home is as smooth as possible, even for babies with really complex medical needs.
So that's 247 care outside a hospital. That means managing, complex equipment, round-the-clock staff, but in someone's house. That sounds like a huge logistical challenge. Needs constant checks on staff competency, I imagine. It does. It's a massive undertaking, and it effectively de-risks things for the hospital.
Right.
The aim is to stabilize the baby, empower the family, and, crucially, keep those acute hospital beds free for others needing immediate critical care.
Makes sense. Okay, so the child grows and the needs change. We move into childhood and development. And here, the plan highlights something specific. The Autism Assessment Center. This seems targeted.
Oh, definitely. It tackles a major pressure point in the Irish system. Developmental assessments, they often have really long public waiting lists.
Yeah, you hear about that. Causes a lot of anxiety for families, delays getting help.
Exactly. So by providing these specialist assessments and, importantly, clear, actionable recommendations, this center helps shorten those waits. It eases a bottleneck, meaning kids get the support they need faster, which improves outcomes later on.
Okay. And then as they grow older, moving through school, maybe into work, the support evolves again.
It does. At the college level, for instance, they talk about educational support, providing personal assistance, note takers for students with disabilities in Irish universities and colleges. It's about making sure education is accessible for everyone.
And then for working life.
For the working world, the focus shifts to prevention with their occupational health services. Think proactive stuff, health screenings, wellness programs, mental health support for employees, keeping people healthy before they get sick.
Why is that bet so important for the wider healthcare system? I mean, workplace health.
Well, it's pretty fundamental, isn't it? A healthy workforce is less likely to need acute care down the line. Investing in prevention screenings, wellness, it reduces the long-term burden, fewer chronic illnesses, less time off sick, less burnout. It keeps people productive and, frankly, out of hospital beds. It's a key part of the whole health economy.
Right. Preventative. Got it.
Yeah.
Of course, delivering all this care across a whole life needs highly skilled people. Which brings us to the CPL Institute. This seems to be their training engine.
That's a good way to put it. It traces back to NEFAST, started way back in '87. It's their hub for professional development and accredited training.
And the accreditations look serious. QQI, PHECC, IOH, even a UCD partnership.
Yeah, the accreditation is key. QQI is the big one for Irish national qualifications. But having PHECC for pre-hospital care, IOH for health and safety, and the UCD link, it shows real breadth and ensures the training is relevant both here and, internationally.
What kind of training are we talking about specifically? It seems quite targeted.
It is. They focus on areas where there's high demand or real complexity in the HSE. Things like infection prevention and control, always critical. Clinical skills refreshers, medication administration, huge responsibility there, mental health awareness, and then specialized areas like dementia and palliative care, sensitive stuff.
Okay, and you mentioned a business case here, something about QQI training moving back to in-person.
Ugh. Yes, this is really interesting. They noticed a problem, apparently quite common. Candidates were doing QQI modules online, getting certified, but sometimes lacked that practical, hands-on confidence. They needed more support when they actually started the job.
So the online convenience maybe didn't translate fully to real-world skills.
Kind of. It's a challenge everywhere, right? Balancing digital efficiency with the need for practical competence, especially in healthcare. So Servisource made a strategic decision, reintroduce accredited in-person QQI healthcare training.
Even though that's probably more complex for them to run logistically, going back to face-to-face.
Exactly. A deliberate choice to prioritize quality and the impact. They reported much better knowledge retention, staff were more confident in patient scenarios, and overall a more capable workforce needing less hand-holding. It basically raised the bar, addressing a potential gap left by the rush to online training.
That really sets a standard for quality.
Okay, so we've seen individual skills. Now let's shift to supporting the system itself. The logistics of staffing, keeping things running, especially when winter hits and demand just explodes. Operational resilience.
Right. This is, you could say, their bread and butter for the HSE. They're an official HSE-approved supplier, specifically a Tier 2 provider for short-term, temporary, and locum staff. And critically, this isn't just one area. They cover all 6 health regions across Ireland.
All 6, wow. And the types of staff, it seems comprehensive.
It is. Temporary, fixed-term, permanent roles. They provide doctors, nurses, the essential healthcare assistants or HCAs, social care professionals, and don't forget the clerical workers, grades the 3rd to 6, the people running the admin engine behind the scenes.
And they have some pretty punchy metrics to back this up. A 95% shift fill rate, over 1,300 temporary workers deployed. That sounds intense.
It is intense.
Yeah.
And they guarantee a 1-hour response time for urgent requests, 365 days a year coverage. It's designed for speed and reliability. Okay, 95% fill rate is huge. But how do you manage that sustainably? You need a massive ready pool of people, right? And how do you avoid burning them out with rapid deployments?
Good question. It relies on a very sophisticated and actually global recruitment network. For permanent roles especially, they're looking ahead to 2025, leveraging partnerships in the UK, India, the UAE, places with strong healthcare talent pools.
So international recruitment is key.
Very much so. In 2024 alone, they helped over 523 international healthcare professionals find jobs in Ireland. And they mentioned a 1 in 3 interview-to-offer rate, which is pretty impressive.
Bringing in 500-plus international staff, that's more than just paperwork, surely. There are integration challenges, cultural adjustments. How do they make sure those professionals land smoothly and are effective quickly?
That high conversion rate suggests they have a solid process. It has to involve more than just recruitment, rigorous pre-screening, probably cultural competency training, relocation support, making sure people arrive ready to hit the ground running and meet those high HSE standards.
Let's make this concrete. The plan has business cases. Kerry University Hospital, what was the issue there?
Kerry had ongoing issues with permanent nurse shortages. They were relying heavily on expensive agency staff, which isn't sustainable long-term and can affect morale.
Right.
So Servisource didn't just plug gaps short-term, they focused on finding and placing people into permanent roles. The real value wasn't just filling a post, it was stabilizing the workforce, cutting that vacancy rate, and genuinely boosting morale for the existing team by easing their burden.
Okay, that's long-term stability. What about sudden surges? Regional Hospital Mullingar is mentioned.
Mullingar faced HCA shortages, often triggered by seasonal illness or unexpected absences. That puts immediate pressure on wards.
Yeah, you lose a couple of HCAs and the whole ward feels it.
Exactly. So the solution there was rapid deployment of qualified HCAs, quick, flexible support to maintain care levels, and give the permanent staff breathing room during those peak times.
And we shouldn't forget the admin side. The mobile vaccination unit example sounds like they needed help with the sheer volume of work during winter jabs.
Absolutely. Vaccination campaigns mean a huge spike in admin scheduling, registering people, managing data. By providing flexible clerical staff, Servisource freed up the clinical team's nurses, doctors to just focus on giving the vaccinations. Smoother for patients, less admin stress for staff. It's that background support that often goes unseen but is vital.
Okay, now let's move into the really specialized stuff. Services that need very specific skills or technology, going beyond general staffing, starting with patient transfers assisted admissions.
Yes, this is quite specific. It's not your standard patient transport. It's a service led by a psychiatric nurse for managing mental health transfers, both voluntary and involuntary. And it has to be fully compliant with the Mental Health Act 2001.
Psychiatric nurse-led.
Yeah.
That implies a high level of clinical oversight during what can be a very difficult, sensitive process. Needs specialized training, I imagine.
Definitely. It ensures the transfer is handled with clinical expertise, respecting all the legal requirements and the patient's emotional state. It's about providing care that meets very specific, demanding standards in tricky situations.
And then back to my home care. You mentioned earlier they provide that 2047 support for infants.
Mm.
The plan also highlights their GCI accredited for home care. That sounds significant.
It is significant. JCI Joint Commission International, that's a major global standard for quality and patient safety. Achieving that for home care is unusual and very demanding.
Why demanding? What are the challenges of maintaining that standard in people's homes versus a controlled hospital setting?
Well, think about it. Infection control, patient safety protocols, they have to be rigorously applied in constantly changing environments and each patient's unique home setting. The home first idea means rapid deployment after hospital discharge, quickly assessing if the home can safely support recovery, often after complex procedures. It's logistically very tough.
And sometimes the challenge isn't just logistical, it's human. There's a case study mentioned a 52-year-old patient, complex needs, initially didn't want help.
Yes, that's a really telling example. This person had spina bifida, mobility issues, heart problems, plus a history of difficult infections like VRE and MRSA, complex case. And that reluctance to accept care, it's common. People fear losing independence, perhaps.
So how did they overcome that? What made the difference?
It seems to have been the combination of a consistent, highly skilled care team who built trust alongside really strict infection control measures tailored to the home. The impact was clear. The patient's health actually improved, fewer infections, fewer hospital readmissions, and crucially, they felt empowered to stay safely at home. That takes huge pressure off the hospital system.
Moving towards later life now, winter often sees surges in hospital admissions for older adults, often due to falls, right? Things that might have been preventable.
That's a huge issue, and traditional pendant alarms, while helpful, are reactive. They alert after a fall. The push now is towards proactive care, preventing the crisis in the first place.
And this is where technology comes in. The plan mentions Isaac Care's AgeWell platform. How does that work?
It's quite advanced. It uses sensors and technology to monitor activity, movement, even vital signs remotely. But the key is the health insights it generates. It provides 247 support, but also early alerts.
Early alerts. How does that prevent a crisis?
By spotting changes early, maybe activity levels drop, or sleep patterns change, or subtle signs indicate a potential health issue developing. The platform flags these to clinicians before it becomes an emergency. It allows for early, targeted intervention, maybe a GP visit, a change in medication, extra support preventing that trip to the emergency department.
And there's an app for families, too. The Isaac Circle of Care app.
Yes, that's important for reassurance. It gives families visibility, 247, into how their loved one is doing. It reduces anxiety for everyone and helps keep the client safely at home for longer because the whole support network, family and professionals, is connected and informed.
Okay, one final area, strategic outsourcing. This sounds like higher-level operational support for organizations like CRU, HIQA, even the HSE itself, using things like MSP, RPO, BPO.
Exactly. MSP is managed service provider, RPO is recruitment process outsourcing, BPO is business process outsourcing. Essentially, Servisource takes on managing entire functions, often non-clinical but vital ones, like large-scale recruitment campaigns, compliance processes, complex admin tasks.
Why would an organization like the HSE outsource that?
It lets them focus purely on their core job delivering healthcare. By handing over complex recruitment drives or administrative burdens to a specialist partner, they free up their own resources and benefit from specialized expertise and efficiency.
And there's a measurable impact mentioned. Modernize recruitment, cutting applicant queries.
Yes, quite dramatically. They streamline things so much, applicant queries drop by over 70%. Think of the time that saves.
That's huge.
And another striking example. Designing digital forms for big compliance or recruitment projects. They built in logic to ensure zero data errors. In the public sector, data accuracy is absolutely critical, achieving zero errors through smart design. That removes massive amounts of manual checking and operational drag.
Okay, so we've really covered a huge amount today. For you listening, we've traced this support from, well, literally day one with newborn care, through developmental support, education, work, complex home care for adults, right up to overhauling massive recruitment systems for the HSC itself. The promised service source right when you need us seems to underpin it all.
I think the key takeaway is that integrated approach. It's the connection between having well-trained people, thanks to things like that renewed focus on in-person QQI training combined with smart technology like Isaac Care, and underpinned by really agile, flexible staffing. That combination is what builds resilience across all those 6 health regions, especially when winter bites hardest.
So we've seen technology like Isaac Care's Age Well helping manage health proactively, making things more efficient. But we've also talked about the deep human compassion needed for things like assisted admissions or end-of-life care. It leaves us with a final thought for you to ponder. Looking ahead, where's the bigger challenge likely to be in healthcare support? Is it scaling up the efficiency of technology even further? Or is it ensuring we always maintain that essential, personalized human touch, especially during the most vulnerable times in a person's life? Something to think about until our next deep dive.